Welcome to our channel HASHMICLINICS.
Welcome. In this clinical deep dive, we're going to build a really practical, multi-layered understanding of ARGENTUM NITRICUM. The goal here is to get way beyond just memorizing keynotes and to really grasp the core essence of this incredibly important, but, often misunderstood remedy.
So here's our game plan. We're going to build this picture systematically. We'll start with its central character, then move into the mind, the physical generals, the particulars, and then get right down to the practical stuff, when to use it and how to tell it apart from its closest lookalikes.
Okay, first things first, if you want to prescribe ARGENTUM NITRICUM with any real confidence, you absolutely have to get to the heart of it. We need to understand that central disturbance, the thing that really animates the entire remedy picture.
This line right here, it's a classic from our Materia Medica, and it gives you such a powerful image to start with. It points to a state of just profound nervous system exhaustion. It manifests physically as looking old before your time, a patient who seems worn out, withered, and just drained by years and years of internal hurry and anxiety.
So this is the absolute crux of the matter, a fundamental lack of control and balance. You've got the emotional and impulsive parts of the mind running wild, just in a state of chaotic overdrive, while the higher, rational mind is too weak to keep everything in order. This internal split, well, that's the engine that drives the whole pathology, from the weirdest phobias all the way to physical tremors.
Okay, so we have that core idea of imbalance. Now let's see how that plays out in the mind and the emotions. Because honestly, it's often right here, in this landscape of hurry, worry, and fear, that you're going to find the most solid reasons to prescribe this remedy. This simple phrase, it just perfectly captures the triad of the ARGENTUM NITRICUM mental state. There's this constant internal feeling of being rushed. For them, time seems to pass way too slowly, which just makes them more anxious and hurried. And then you layer on top of that this pervasive anxiety and a whole host of peculiar and frankly often disturbing thoughts.
Now, the anxiety here is usually very specific and situational. Anticipatory anxiety is a massive keynote. This is your classic remedy for what we call examination funk or stage fright, the kind that often causes a sudden bout of diarrhea. The phobias are also textbook. Claustrophobia, a huge fear of heights, and then that very, very peculiar fear that the projecting corners of buildings are just going to fall on them as they walk past. This is where it gets really telling. A defining feature of this mindset is the presence of these strange impulses and intrusive thoughts. The patient is plagued by this inner hurry, which makes them walk faster and faster. But the most striking one, the one you'll never forget, is when they're up high, like on a bridge, and they get this sudden, terrifying impulse to jump. Now, it's vital to know this isn't about suicide. It's a momentary, horrifying impulse that's born from that core loss of mental control.
All right, we've got a really clear mental picture now. So let's start layering on the physical generals and the modalities, the things that make them feel better or worse. These are the factors that really govern the whole case and help us lock in our choice.
And right away, we hit the remedy's core thermal state. ARGENTUM NITRICUM is a profoundly warm-blooded patient, one of the warmest in our entire Materia Medica. They feel smothered by warmth and have this intense craving for cold, fresh, open air. They want the wind blowing right on them. That is a powerful differentiating symptom. And also take note of this peculiar one, palpitations get distinctly worse when they're lying on their right side.
And this is a classic confirmatory symptom. It's a true paradox. There is an irresistible, intense desire for sugar and sweets. But what happens when they indulge? It consistently makes them worse. We're talking immense gas, indigestion, and, very often, diarrhea.
Now let's move on to the really characteristic particulars. We'll focus on the peculiar keynotes that just solidify the prescription. And as the subtitle suggests, we're going to look at two of its most famous features, splinters and gas.
The splinter-like pain is a sensation that is so characteristic of this remedy, and it can show up in multiple systems. The classic presentation, of course, is that feeling of a splinter in the throat when swallowing, but you'll also find this keynote in the urethra or even in the uterus. Also, always be on the lookout for profuse, thick, yellow-green, gunky discharges from any mucous membrane.
The gastrointestinal tract is a major center of action for ARGENTUM NITRICUM, and it's really defined by two things above all else, a tremendous amount of gas and very, very characteristic stools. So the clinical picture you need to see is the combination of these symptoms. The patient is suffering from painful bloating, feeling like their stomach might just burst. Belching is difficult, but when it finally happens, it is loud and explosive. And this is so often paired with the classic chopped spinach stool, a green, slimy, noisy, gassy diarrhea frequently triggered by that anticipatory anxiety or by eating sweets.
Now, going back to that core disturbance, the remedy's impact on the nervous system is profound. It produces symptoms of weakness, incoordination, and tremor that you can actually see pretty easily during a physical exam.
So remembering that central theme of incoordination, here is its physical manifestation. There's a noticeable tremor, especially of the hands and legs, along with a general weakness. In more advanced states, this can progress to full-blown ataxia, where the patient can't walk with their eyes closed and has a staggering gait. And a particular weakness and rigidity in the calf muscles is also a highly characteristic feature.
With a clear picture of the remedy now formed, let's take a quick look at its practical application in both acute situations and in those deeper, chronic diseases. You should definitely consider ARGENTUM NITRICUM for acute inflammations of mucous membranes that are intense, have a lot of purulent discharge, and feature those signature splinter-like pains. It's a top-tier remedy for purulent eye infections, especially in newborns, and for that acute gastroenteritis that's triggered by anticipation. In chronic cases, its sphere of action covers some really deep-seated neurological conditions like locomotor ataxia. It's also a primary remedy for those long-standing functional problems that are driven by that anxious, hurried constitution. Things like brain fag in students, the chronic laryngitis of a professional speaker, and, of course, established anxiety or phobic disorders. Finally, let's just refine our understanding by looking at a differential diagnosis. Being able to tell a remedy apart from its closest relatives, well, that's the hallmark of really precise prescribing. We'll compare it with a key remedy and then boil everything down to the most critical prescribing pearls.
Okay, so ARGENTUM NITRICUM versus Gelsemium. This is a common point of confusion because they both share that profound anticipatory anxiety and trembling. But here's how you tell them apart. Thermally, ARGENTUM NITRICUM is hot and hurried. Gelsemium is chilly and is characterized by the 4 Ds: dullness, dizziness, drowsiness, and dumbness. The trembling of ARGENTUM NITRICUM comes from nervous excitement. In Gelsemium, it's from a profound muscular weakness that's almost a paralysis.
So here it is, your practical prescribing checklist. When these 4 pillars are clearly present in a case, the characteristic mental state, the warm-blooded thermal modality, that paradoxical craving for sweets that make them worse, and one or more of the classic keynotes, your prescription of ARGENTUM NITRICUM is built on a very solid foundation. You know, the picture of ARGENTUM NITRICUM seems almost tailor-made for the anxieties of our fast-paced modern world. As you continue your clinical work, just hold this image of the hurried, anxious, warm-blooded, and impulsive patient clearly in your mind. Because when you recognize its distinct pattern, you'll be able to bring a profound sense of balance to the internal chaos it represents.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.